I am Stephanie Anselmi. I am a physician assistant and I am presenting about stroke. A stroke, also known as a CVA or cerebral vascular accident, occurs when blood flow to the brain is blocked or there is a sudden bleeding in the brain from a blood vessel rupture. It is referred to as an accident because of the sudden and unexpected effects that it has on an individual's health and function. A stroke that occurs because blood flow to the brain is blocked is called an ischemic stroke. About 87% of strokes are ischemic. The blockage in the brain is usually caused by a piece of cholesterol plaque or a blood clot. If the blockage occurs locally in the brain, the condition results in a cumulative occlusion of an artery called a thrombosis. If the blood clot travels from somewhere else in the body to the brain, it is called an embolic stroke. TIA stands for transient ischemic attack and is a warning of a stroke. With a TIA, the blockage is only temporary and breaks up before there is any damage to the brain. It typically resolves in less than 24 hours, and symptoms may wax and wane. A stroke that occurs because of sudden bleeding in the brain is called a hemorrhagic stroke. There are 3 types of hemorrhagic stroke or intracranial hemorrhage: bleeding within the brain tissue, subarachnoid hemorrhage, or bleeding between the brain and the inner membrane that surrounds it, and subdural hemorrhage, which is bleeding between the outer membrane and the inner skull. Intracranial hemorrhage and subdural hemorrhage occur in about 10% of stroke cases, and subarachnoid hemorrhage occurs in 3%. Signs of a stroke may vary because of what vascular distribution is compromised. Symptoms can include mild weakness to complete paralysis or changes in sensation on one side of the face or body. Other signs may include sudden onset headache, loss of vision or double vision, difficulty speaking or understanding language, dizziness, or sudden change in balance and gait. Stroke is a medical emergency. Because there are now therapies that may improve your chance of survival and recovery, it is essential to get to the hospital as soon as possible. Time equals brain. A stroke can cause lasting brain damage, long-term disability, or even death. Upon arrival to the emergency department, the medical team will assess your condition, obtain immediate CT imaging of your brain, and determine if you qualify for a medication or surgical procedure to improve your outcome. Other testing for stroke may include MRI brain, echocardiogram, EKG and heart monitoring, blood tests to check your cholesterol, blood glucose, and tests for blood clotting. Sometimes lumbar puncture is necessary if a bleed is suspected and not apparent on imaging. Managing risk factors is the most important way to prevent a stroke. Risk factors can include high blood pressure, high cholesterol, diabetes, smoking, sleep apnea, obesity, atrial fibrillation, carotid artery disease, and blood clotting disorders. Many risk factors are modifiable with correct treatment and strict compliance with medical recommendations. Antiplatelets, anticoagulants, and cholesterol medications are used for stroke prevention depending on the stroke's mechanism of action. Compliance with your medications and appropriate neurovascular monitoring is essential. A patient's recovery will depend on how serious the stroke was and how quickly they were treated. A rehabilitation plan is critical to help patients get back to what they used to do before their stroke. In summary, be knowledgeable about stroke and TIA. Be vigilant for signs and symptoms in yourself and your loved ones. Be quick to act and go immediately to the hospital if you or a loved one is having signs of a stroke. Be compliant with medical recommendations. Finally, follow up with your physician and neurologist for appropriate post-stroke management.